Hello, I'm Dr. Helen Pinsanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're going to be talking about vitamin D deficiency, a widespread condition that can affect bones, muscles, immunity, and even pregnancy outcomes. To help us understand what causes it, how it's diagnosed and treated, and how lifestyle plays a role, I'm joined by my friend and colleague, Dr. Bryn Henderson, a board-certified physician and leader in regenerative medicine for many years. Dr. Henderson, thank you for joining us.
Well, you're more than welcome. Thank you for having me.
So, what exactly is vitamin D deficiency? So many of the people where I tell them they have vitamin D deficiency, they say, well, I'm out in the sun all the time.
Well, vitamin D deficiency occurs when there isn't enough vitamin D in the body to maintain normal calcium and phosphorus balance, which are essential for bone and muscle health. It can result from low dietary intake, inadequate sun exposure, certain medical conditions, or problems with vitamin D metabolism.
All right, so we're back to that sun exposure again. What if someone has plenty of sun exposure, but not enough calcium and phosphorus? You're saying there's a balance. Can you explain to our audience about this balance of calcium and phosphorus and vitamin D? Because I think that's where the patients are confused, because they're telling me, but doctor, I'm out in the sun. We live in California.
Well, my response would be it's really a disorder, as the Chinese will tell us, and we'll get there, of kidneys. So vitamin D plays a critical role not only in the calcium and phosphorus metabolism, but the absorption of those in the intestines or maintaining them can be inadequate because of low levels of them in your bones.
Let's talk about phosphorus. Everybody probably takes calcium, CalMag, or whatever they take, but this phosphorus, this is new to people concerning vitamin D. So let's expand on that phosphorus.
Okay, so phosphorus is an essential element. It's a mineral in our body that plays a role in all kinds of reactions. It's a vital role in bone health and teeth formation, but what you probably don't know, it's essential for energy production and cell structure.
So what foods are high in phosphorus?
The foods high in phosphorus include dairy products, meat, poultry, fish, eggs, nuts, seeds, and legumes, and some grains.
Sorry to take a little sidebar there, but I wanted to get everyone on the same page that it's not just you're low in vitamin D. There has to be a balance of vitamin D, calcium, and phosphorus. Okay, so let's talk about genetics playing a role in vitamin D deficiency.
Well, some people have genetic variations in vitamin D receptors. There's enzymes that activate vitamin D. They may be lacking and making them more prone to a deficiency.
And what about early development?
Oh, yeah, that's for sure. Vitamin D status during pregnancy is critical, literally critical. Deficiency in the mother can affect the baby's bone development and have long-term effects in immunity and metabolism. Research even suggests that in utero, deficiency can alter how cells function, increasing the risk of certain chronic diseases later in life.
Okay, let's talk about symptoms that people should look out for in their own body or a loved one.
Okay, well, so many people have no obvious symptoms at first, but over time, deficiency can cause muscle weakness, bone pain, and fatigue. In children, it causes rickets, a condition that's characterized by weak bones. They lead to skeletal deformities, such as bowed legs or delayed growth. In adults, the deficiency contributes to osteoporosis and increased fracture risk, and we should always check their kidneys.
All right, how is vitamin D deficiency diagnosed?
In vitamin D, we measure blood levels. The blood levels are measured in a regular blood panel. Levels below 20 nanograms indicate a deficiency. The exact target may vary depending upon age, health status, and guidelines. Now, the mainstay in terms of supplementation is usually vitamin D3 because it's more effective than D2 at raising blood level. The dose depends on how low the levels are and the person's risk factors. For most, it's taken daily, sometimes weekly, often in injections, and used under supervision.
All right, let's talk about traditional Chinese medicine. What do they do?
That's an excellent topic because that's where I learned the most about this. Vitamin D deficiency symptoms may be interpreted as imbalances in kidney or spleen, affecting bones and muscles. And the patients usually feel cold. And the therapies include herbal formulas, acupuncture, and dietary changes to support energy flow and bone nourishment. Some compounds have been shown in the lab studies to interact with vitamin D receptor, but these are not substitutes for standard supplementation.
Now we get to the fun part, your area of expertise, regenerative medicine. What can we do about vitamin D deficiency?
There's currently no regenerative therapies that can stimulate the body's use or the amount the body keeps of vitamin D. However, vitamin D sufficiency improves all kinds of outcomes for regenerative treatments, especially musculoskeletal and bone.
All right, so now we've come where we've tested for vitamin D. We've put the patient on vitamin D3. But what can the patients do at home to make sure that they're not only taking their vitamin D3, but they can do other things to help themselves?
The patients can spend safe time in the sun, eat vitamin D rich foods like fatty fish and fortified dairy, stay active, and maintain a healthy weight. Some people will still need supplements, especially if they have darker skin, live in high altitudes, or have certain medical conditions.
So, what's the outlook for people with vitamin D deficiency?
With treatment, the prognosis is excellent. Most people can resolve normal levels of vitamin D within months. The key is addressing the cause and maintaining adequate intake.
I want to talk about what happened during COVID. I was a COVID doctor, and in March of 2020, when we had the lockdown, and for me, where I was, people were dying every 3 days. I was signing death certificates like I wish I could sign checks, but I mean, I was like every 3 days, someone was dying, and very sad, shocking. We were all in shock. But then I read this study where they took all the laboratory results of people who died first of COVID, and they put it into a computer, and they said, tell us what all of these people had in common. And it was the usual hypertension, diabetes, and the other comorbidities with those things. But the one thing that jumped out was low vitamin D. And we all went, it's the immune system was low.
Absolutely right. The immune system is major target if you're low on vitamin D.
All right, let's talk about your mnemonic for vitamin D health.
Well, that's fun. It's SUND. So starts with S for safe sun exposure.
What does the U stand for?
It's use fortified and vitamin D rich foods.
N.
Nutrition through balanced diet and activity.
And D.
Daily or prescribed supplementation when needed.
Let's talk about those fortified foods rich in vitamin D so that people know when they go shopping, I got to buy this. I'm assuming salmon is one.
Well, sure, fish is rich in vitamin D. And as noted, the dairy products like milk and yogurt and soy, almond, oatmeal, orange juice, and breakfast cereals.
Thank you, Dr. Henderson, for helping us understand vitamin D deficiency and how to prevent it. If you or someone you love has low vitamin D, know that effective and affordable treatments are available, and small daily habits can make a big difference. So, thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen Pinsanti. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.